House Bill 2254. Imagine this. You go to your family doctor, and instead of billing your insurance each time you visit, your doctor now gets a flat monthly payment from your insurer, no matter how many times you come in or what care you need. At first, that sounds efficient, but it also changes how care decisions and costs are managed behind the scenes. What the bill says it does? House Bill 2254 lets PPO and EPO health insurance plans use value based or capitation contracts with primary care doctors, paying them a set amount per patient each month to focus on cost control and preventative care. What it actually does? This means big insurance companies can now use capitation contracts previously limited to HMOs, while smaller or rural doctors lose leverage to negotiate fair terms. It shifts financial control from doctors to insurers who decide performance targets and saving rules that affect how care is delivered. Now, who benefits? Large insurance like Blue Cross Blue Shield, and employer coalitions seeking predictable health costs, big physician groups that can manage complex contracts. Now, who pays the price? Independent and rural doctors who can't absorb capitation risk, patients with chronic or costly conditions, and the public since the contract details and performance data aren't transparent. Why this matters. When care contracts become private and complaint driven instead of publicly reviewed, everyday Texans have less say in how healthcare money is spent or how treatment decisions are made. The promise of value based care sounds good, but without strong oversight, it can mean less access and more corporate control over who gets treated and how. And questions you can ask your lawmakers. Why rely on complaints instead of requiring the state to review these contracts before they start? What happens to small practices that can't compete with large health systems under this new model? And how will patients know if cost cutting incentives start limiting their care? Bottom line, House Bill 2254 shifts power from local doctors and patients to insurance companies trading oversight for cost control that may not put Texans first.